The Hillsides mission is truly to help children, youth, and families heal, grow, and thrive.
We work with children and adolescents who have behavioral health needs. So we provide comprehensive mental health services. That includes like individual, group, and family therapy, case management, nursing services. So it's really a high needs support for children and adolescents. What sets us apart is they come to us for prolonged periods of time. So it could be residential where they're staying with us and sleeping here, or it could be one of our day treatment programs. We work with kids as young as 6 all the way up to 17, and we provide really structured treatment. They're attending different groups with us and different activities so that they can get their trauma-informed mental health care. Hillsides has been around for over a century.
In the past 5 years, what we found is there was an unmet need for children, youth, and families who had commercial insurance.
So Hillsides Cares started in 2021, and it was really started based on community need. What makes it different is that we work with families in our community that have private insurance.
Traditionally, we were serving children with public funding, Medi-Cal, Medicaid.
But this specific program has been able to tap into our community in a different way. So it could be families who maybe have not been a part of the child welfare or foster care system, but still need really customized, nurturing, trauma-informed mental health care. So we started that hard work of getting contracted with as many of the healthcare plans as we could.
The services we provide through Hillsides Cares is similar to the services we traditionally provided. The main difference is we developed a partial hospitalization program and an intensive outpatient program. So we're able to provide these intensive services, but in a much warmer, home-like family environment.
So we're located in Pasadena, California. The campus is on 17 acres, right where Pasadena and Highland Park meet. We have a state-of-the-art art studio, music studio, we have a pool, we have outdoor recreation areas. So there's also a lot of really fun and engaging enrichment activities that the kids and adolescents can participate in. We've worked with hundreds and hundreds of kids in the last 3 years, and we've had really great outcomes. They like to be here. So you have invested kids, parents that feel comfortable that their children are in a really safe and nurturing environment. So that sets a really strong foundation. So then the mental health actually works.
We introduced trauma-informed care about 10 years ago to our organization, and it was a game changer. It is a way of looking at human beings in a very non-judgmental manner. What we see is a quicker de-escalation of behaviors, because what we tell our staff is strike when the iron is cold, not when it's hot. So often when someone is really agitated, we can't hear reason when we're hot. So actually allowing someone to calm down, and once they're in a mellow place, that's when they can hear you and you can discuss maybe what they could have done differently. And we look at care as seamless, and what seamless means to us is continuity of care. And what does continuity of care look like? It's having the same treatment team follow you through our different programs.
A big piece of it is building rapport. So if you're not trusting the provider that's providing services to you, it's also hard for it to be effective. And so if you think about continuity of care, that's really how you move through the system. So it's a really critical component of mental health care, which is why I think Hillsides does a really good job of providing this full continuum of care, from really prevention, early intervention type services to the highest level, like residential treatment, and sort of all the steps in between.
In terms of the community and their involvement with Hillsides, I hope that they know the biggest impact we make is out in the community. It's the 14,000 children, youth, and families we serve in Greater LA. We have a lot of people in the local community involved, but I would always love more local businesses because it's a partnership. I feel so proud every day to work for an organization that truly cares about its workforce and its client population, and every day strives to make this world a better place. We are here, and we are providing a very vital service. So if you or your friend is struggling with any of their children and you have insurance or you don't have insurance, please reach out to us because we will figure out a way to serve you and your child and help your life get better.